The focus of this presentation is on using a behavioral assessment tool to screen for the presence of pain in older adults who have difficulty communicating. We will describe the PACSLAC-2, a behavioral checklist that can be used to screen for pain in older adults with cognitive impairments, and provide a brief description of how the PACSLAC-2 could be applied in a clinical setting. Further training on the use of this tool is required to ensure consistent scoring and confidence in use of this tool by healthcare providers, so consider this presentation an introduction to the tool. In the 4th and 5th sessions of the series, we discussed when behavioral assessment tools may be appropriate to use with clients who are unable to provide a self-report score of pain. For example, an older adult with advanced dementia. A behavioral assessment tool is one part of a more comprehensive assessment to determine whether someone has pain and what treatments should be used. The Pain Assessment Checklist for Seniors with Limited Ability to Communicate 2, or PACSLAC-2, is a behavioral checklist that is recommended for use to screen for pain in this population. The PACSLAC-2 has 6 different categories of behaviors. Each category has between 1 and 11 behaviors that are checked if present. The total numbers of behaviors observed is added up to give a score that can range from 0 to 31. Since behaviors differ between individuals, there is no way to determine what scores indicate mild, moderate, or severe pain, and scores cannot be compared between people. However, if an individual shows an increase in the number of behaviors between a resting position and when he or she is being moved, or during a procedure, the increased score may indicate an increase in pain. Only the total score should be used clinically, and not the scores on the subscales. The PACSLAC-2 can be used to screen for pain on admission, during regular audits or reviews, or any time a change in behavior is reported that might be related to pain. The tool can also be used to determine if pain treatment goals have been achieved. Compared to other behavioral pain tools, the PACSLAC-2 has a longer list of behaviors that can be checked. The PACSLAC-2 appears to be more sensitive to detect pain than other tools. Each time the PACSLAC-2 is used to screen for pain in an individual, the assessment conditions should be the same. For example, if you observe the client during a transfer from lying to standing, repeat those conditions on subsequent assessments so that the scores can be compared to determine if treatment goals have been achieved. Don't forget to document the score, the name of the tool you used, and enough detail about the observation period that it can be repeated. Training is required for healthcare providers to use this tool. Contact your educator or practice lead regarding how to receive training to use this tool. To summarize, pain assessment may include use of a behavioral assessment tool like the PACSLAC-2 to screen for pain if an older adult isn't able to provide a self-report. The score from tools like the PACSLAC-2 are not the same as a pain intensity score from a self-report tool. The conditions of the assessment should be repeated each time so scores can be compared. Document which tool was used and what the conditions were. Incorporate your findings as part of a comprehensive assessment and treatment plan. Note that no behavior is entirely pain-specific, and the various behaviors listed on the observational pain assessment tools may be due to causes other than pain. This is why clinical judgment is important prior to making decisions concerning interventions. Note this important precaution. The developers of the PACSLAC-2 specifically disclaim any liability arising directly or indirectly from use or application of the PACSLAC-2. Use of the PACSLAC-2 may not be appropriate for some patients, and the PACSLAC-2 is not a substitute for a thorough assessment by a qualified health professional. The PACSLAC-2, like other observational pain assessment tools, is a screening tool and not a definitive indicator of pain. As such, sometimes it may fail to identify pain, and other times it may incorrectly signal the presence of pain. The PACSLAC-2 should be used by qualified healthcare staff within the context of their broader knowledge and examination of the patient.